Hi, I'm Dr. Joel Cherdack, President of Houston Regenerative Medicine. Recently, we've been getting a lot of inquiries into what's referred to as the Wolverine Stack. So what this term refers to is a combination of peptides that, when combined together, provide a synergistic effect to where you're getting the benefit of all of the peptides in the combination instead of just the individual effects of each individual one. Now, this Wolverine Stack can be different depending on which clinic you're getting it from and who's actually come up with the combination. So at our clinic, we have what we refer to as our Wolverine or performance stack of peptides. And this consists of 4 different peptides that we combine together so that a patient gets a really great benefit of peptide therapy in general. So the peptides that we use in our combination of peptides are going to be BPC 157, TB 500, ipamorelin, and the last one is going to be CJC 1295. Now I'll talk about each one of these individually. So BPC 157, the BPC stands for body protective compound. It was isolated initially in the human gut, and what they found is that this peptide actually helps to regenerate the gut lining, heal the gut, and allow your body to be able to process food without it degenerating over time. Now, what they found is that this compound also has the effect of healing and regenerating muscle tissue and increasing recovery from muscle strain. So this one can be used, it can be used locally to treat a muscle sprain or strain. It really helps with chronic muscle fatigue or with ligament or muscle injuries. The second one, TB 500, it was isolated from the human thymus. And what this peptide does is it increases metabolism and cell turnover. So again, it helps with recovery and it helps things heal faster. And as we age, as we get older, and or if we are really heavy into exercise and have a heavy exercise regimen, it really speeds recovery. The next one, CJC 1295, and the last one, ipamorelin, are both in a class of peptides. They belong to a class of peptides referred to as growth hormone stimulating peptides. And the name really describes what it does. It attaches to your pituitary gland and maximizes your body's ability to produce growth hormone. And the effects of growth hormone are going to be to maintain or to increase lean muscle mass, to improve sleep quality, and again, to speed recovery. So patients that really benefit from this combination of peptides would be any patients taking GLP-1s because it'll help maintain lean muscle mass as you're losing weight. Also, anybody who's over 35 and is starting to feel those aches and pains that we get as we get older, it's really a much better solution for that than to take continuous over-the-counter medications like Tylenol and ibuprofen. This doesn't tax the liver and tax the kidneys like those other over-the-counter medications do. So the combination of these peptides together in our quote-unquote Wolverine Stack really has a great effect on improving the quality of sleep, improving muscle mass, and just overall feelings of well-being. So, for example, a lot of our patients that are on GLP-1s will describe over time feeling flat or feeling lethargic, and that can be attributable to just lesser calorie intake. So what this combination of peptides does in combination with the GLP-1s is prevent those symptoms from happening and really help people maintain their lean muscle mass, which is really important. Another category of people that really benefit from this are patients that train very heavily, that are in the gym a lot and are noticing as they're getting older that they're not recovering as fast, or that their recovery is causing them to just have what's called DOMS, or delayed onset muscle soreness. It really helps with that and helps you just feel better overall. So if you have any questions about our Wolverine or Performance Stack, reach out to our clinic and one of our patient coordinators will be happy to answer any of your questions.